but I do want to spend just a little bit of time talking about the recommendations with all of you. And in terms of the work that you do, so schools for Christine, police for Chief Bro, community outreach for Suzanne, mental health services for Chris, which recommendations could have the greatest impact right now for the least amount of investment? This is the low-hanging fruit question. And Christine, can I go to you first, please?
I think education and communication by far. We've seen great results with training, suicide prevention training, the NAMI Connect training. I'm also a trainer. The student mental health first aid, training students to be responsive peers to their own peers. We've seen great results from that. So I think those are the low-hanging fruit, just to continue the efforts that are already underway. And I'll give you an example of that. We do NAMI Connect training for all our staff, 2 hours a year. We had a new staff member last year who received the training. The next day encountered a student, normally would not have asked the next question, but did ask the next question. Are you thinking about hurting yourself? Student replied, yes, had a plan. Had that gone without any intervention, it could have had a very different outcome. Student got help and support and was able to return to school successfully.
Wow, that shows the power of training right there. And it's a 2 hour per year training. It's not a big ask, but it makes a big difference.
No, and it gives staff the knowledge of not only do I know what to say, and I don't have to be afraid of what I'm going to say, creating an issue, but I know how to respond when that student says yes. I know what to do next. I don't have to fix it. I just know the next person to get them to.
Yeah, it's a powerful story. Yeah, Chris, how about you? In terms of these recommendations and in terms of the work that you do, what's the low-hanging fruit? We'll talk longer term and harder later, but let's start with easier.
Yeah, I agree with Christine. I think the low-hanging fruit is education. The more we're aware and the more we learn how to talk about this and understand that it's an illness and that we're not, it's not a scary illness. It can be scary because, you know, it can be life and death, and that's scary. But the person is not scary. The income, the outcome that is potential might be scary, but the person himself isn't scary. And I think so that education and that understanding can really go a long ways. The other thing you'd ask Christine, that was low hanging and low cost. So the low hanging is clearly education. That's also the low cost one. But I think the other piece is, and I know that no matter where you are, we've all got workforce challenges right now, but the people going into the mental health field right now seems to be dropping off. And so finding ways to support that and make that a viable career option for people so that we have more resources available, I think is also important.
Right, encouraging people to go into the mental health field. Go ahead, Chief Bro, low-hanging fruit.
I would echo what everybody else said, education. You know, I see it from the police perspective of how do we get people to understand the signs of somebody in mental health crisis before that 911 call needs to be made. You know, if you think about this, because it's just health. If we do a great job of telling people, you know, if you're having chest pains, go to the doctor, right? Don't wait till you're having a heart attack and you can't move off the floor, right? We need to almost take that same approach to mental health and have people understand the early signs and symptoms to seek help. So, you know, then they don't get to that crisis point where their only option is calling 911 or going to an emergency room. There will always be those people that are in that phase, but how do we do a better job of getting the message out and getting people and the community educated? And a big part of it is stigma, seeking help, you know, and not being afraid to seek help when you need it or a loved one needs it. But also having those difficult conversations, whether it's with students or with loved ones, or, you know, we see a lot of elderly people suffering from mental illness. This isn't, you know, this is across the board. It's across all ages. It's across all walks of life. So, you know, we see it with elderly people, and, you know, that's a difficult conversation for an adult to have with their elderly parent, that you're not okay, and getting them help. So I think, again, it's education. It's the low hanging fruit. And I think it's the simplest thing to do, but I also think it may have the biggest impact.
Suzanne, go ahead, and then we'll go to our audience.
I just think too, in terms of low hanging fruit, I agree with training and education, but really it's a personal investment of time. Because some of these trainings take a little bit of time, 2 hours for the school district, or 2 or 3 or 4 hours, depending on what module you'd like to do for suicide prevention. And other trainings might be a whole day. So really the low hanging fruit is our personal responsibility and saying that I care about this and I take the time to do the training, because we have trainings that are being offered for free for the community. So that's, for me, one of the lowest hanging fruit.
Right. So do you find, Suzanne, people, saying, sure, training sounds great, but I don't have time today. I don't have time next week. Also, sometimes employers, everybody's short-staffed. Employers say, I can spare you maybe next week, Laura, but not today. So
That's
it's
exactly what
tricky.
happens.
Yeah.
It is tricky. It's tricky for, definitely for employers, especially if you have shift workers.
Right.
Or contracts. That's really tough. So how do small business owners put their employees through training, but then they're not on the floor doing their job? And then how do they pay? It's a tricky situation. But that's when the shared community responsibility has to come into play, where people say, this is important to my business, to my employees, to my students, to my staff. We need to make this happen. We have to figure it out, and we have to do it now.